Hello. So I'm going to share a quick video on how we can use this tool called Heidi for generating reports for safe assessments. So as you can see, I'm logged on to Heidi. I have clicked onto the transcribe button. As I do it, it prompts me to say, have I got patient's consent to use Heidi, which is very important. You must seek explicit consent from either the patient, or if they lack capacity, then the carer or the next of kin. So once I select that, you will notice that it has now started to listen to my conversation. So I'm going to use a test patient to do an assessment, and I'm going to go through a structured format where I am going to answer or ask questions or dictate notes. In my opinion, the best way to use this is by doing your consultation. You do the visit, you assess the patient, you make some notes, then you come back, you go into their electronic patient records, whether it's System 1 or EMIS. You gather all the information from System 1 which you need, or EMIS, and then you log on to WebV, you get your blood results, go through their respect forms, so that you've got everything ready when you start dictating. And that would take you about under 10 minutes to do so, and then it will generate the report. So I have seen Mr. John Smith, NHS number 1 2 3 4 5 6 7 8 9 10, at his home. John is 89 years old. He was referred to me by nurse Hannah on 26th of March, and the main reason for referral was multiple falls. I saw John in his own home, which he currently shares with his wife. John was very welcoming and cooperative for his assessment. He's a retired school teacher who told me that he really enjoyed his teaching, and especially the work he did with primary school children. He's been retired for the last 20 years and is enjoying his retired life. In terms of when you're going to use the paper or report to generate from System 1 and EMIS, it will automatically pull out all the repeat medication, all the recorded health conditions. And for EMIS ones, you will look at third-party record and copy paste that on your form. Now, the next section, which is comprehensive history, John is known to have the following long-term health conditions: atrial fibrillation, transient ischemic attack, ischemic heart disease, chronic kidney disease, and osteoarthritis. Systematic review: elderly gentleman with multiple comorbidities, currently struggling with falls, which are mainly environmental in nature. He has had 3 falls, all of them were linked with tripping over objects. He will benefit from input from the core therapy team so that he can undergo Otago exercises and improve his strength and balance. He will also benefit from an advanced care plan, and I have discussed a respect form with him and completed one for him today. He is not for resuscitation. The next section is continence. John is currently fully continent for both urine and stools and is managing independently. Activities of daily living. John is fully independent. He can dress himself. He walks to the local shops. He is driving and goes shopping with his wife. He's able to provide all his personal care. Cooking and washing are done by wife, but that has always been the case. And John does go out in the garden and works on managing small plants and shrubs, and he has a gardener for cutting hedges and other heavy lifting work. The next bit is around medication. John orders his medication himself, gets them delivered by the pharmacy, and is quite good in remembering to take the medication. John is currently on atorvastatin 80 milligrams. His last uh, heart attack was 4 years ago, and he has been on atorvastatin 80 milligrams for a long time. His cholesterol levels are 2.3. So currently, there is no indication for him to stay on such high dose. He will benefit from reducing the atorvastatin from 80 milligrams to 40 milligrams. The next section is for memory. John has no memory concerns. He does feel that his short-term memory is not as good as what it used to be, but he generally enjoys doing crossword and Sudoku and tries to keep his mind active. The next section is social. John lives in his own house, which is a two-story house, and he manages to go upstairs independently. John does drive, and he manages his own finances himself. Next of kin for John is his wife, Mavis Smith, who also has the lasting power of attorney for health and finance. The contact number for Mavis is 012345678910. The next section is examination. John looked alert, oriented, well hydrated. He has mental capacity as per the MCA Act of 2005. Cardiovascular exam, chest was clear on auscultation. Heart sounds were normal. He had irregular pulse of 70 beats per minute in AF. Temperature was 36.7. Oxygen saturation was 97% on air. Blood pressure sitting was 110/70. Standing was 120/70. Abdominal exam, abdomen was soft, non-tender. There was no organomegaly. Bowel sounds were present. Neurological exam, pupils were equal and reactive. He has got equal power in all four limbs. Grossly normal neurological exam. Eyes normal on examination. Fundus normal. ENT, ear, nose, and throat are normal on examination. Musculoskeletal, he has got osteoarthritic changes in both his knees, small joints of his hands. Muscle tone was normal on examination. Feet and ankles, there was no pitting edema or swelling around his ankles. Skin was grossly normal on exam. There were few bruises noted. Brackets, he is on DOAX, bracket closed. And gait, John walked unaided in normal gait. Falls and mobility section, John has had 3 falls over the last 2 years. The first fall was when he was in a shop and he tripped over the newspaper stand and fell forwards onto the floor. He grazed himself but did not require any attendance. The second fall was when he was in his garden, where his wife had moved the lawnmower behind him. He didn't realize he tripped on that and fell backwards. At that point, he had got a laceration on his scalp and had to be taken to hospital for stitches. And he's on a doxaban. He had to have a CT scan of his brain, but he had no permanent damage. The last fall was a month ago, which was when he went to the pharmacy and there was a wet floor sign, which he did not notice, slipped over the wet surface and fell and landed on his buttocks, but was able to get up himself. He reports no palpitations, no dizziness, no blacking out episodes before any of these falls. He does feel that he's clumsy. Frailty score is 6. The frailty score is 5. 6 CIT was 2. Relevant investigation, CT head done with the previous wall, no intracranial bleeding, and it was normal study. His bloods done on 18th of April were UNEs, full blood count, liver function test. His GFR is at 40 with CKD. His liver function and full blood count was normal. Respect form section. A respect form was discussed with patient and completed. Patient is not for resuscitation. The safe assessment was completed by Dr. Satpal Singh Shekhawat. It was done on 7th of May 26. The permission was granted by patient John Smith himself. Other person present during assessment was his wife, Mavis Smith. So as you can see, I've done the assessment report. Now, if I click on stop transcribing, and it'll ask me to choose a template. These are my favorite templates. You can all choose them. So the safe assessment template is what I have chosen. And you will start seeing that it's now analyzing the transcript and generating the report. We have asked team of Heidi to create the report according to the formatting we want it in. So as you can see, it's now generated a report and it does the tasks as well. It's a beta version, so it's reminding me of the respect form in atorvastatin. Now, you might have noticed I haven't put list of problems and things, but Heidi will generate them. If you have created them, you can dictate and it will pick that up. So if I close this so you can see a better view, you will see that that's the safe assessment. So it's pulled up all the formatting. It's created the problem. So recurrent falls, which needs core therapy referral, atrial fibrillation. So these ones, some of them like atrial fibrillation does not really require, I can delete that later. Atorvastatin dose we need to reduce. It's picked up the medication, past medical history. It's got the next of kin and the details. Briefly about systemic review, falls, mobility. So at the top button here, I'm going to copy this. Then the best way to do it would be go into system 1, click on communication and letters, create a new letter, always choose patient's registered GP. And what it'll do is it'll pull in the information fed for patient record. Now, whilst it's open there, one point, please always choose respect an NLACP, which is North Lincolnshire Advanced Care Plan, not plain respect form, because we want to use this detailed one. But in this case, I want to use the safe assessment form, so I'll go into safe care. As I'm in my surgery module, it may not bring that form, so I might have to go. Out a different form, but from when you are in a normal patient, it will bring out the form. My advice will be for you to then copy and paste the form on it, and then edit it before you send it to Lucy and team so that they can form, before sending the assessment forms to the registered GP practice, they have made sure that we meet the standards ICB expects from us. So what I'll do is I'll share this video with all of you. If you find it useful, then please, let us know so that SafeCare can procure it. I'm just going to show you how the report will look on a Word document so you can appreciate what Heidi has done. So as you can see, it pulls out all the information in the format you need. So that's your problem box, your repeat medication, next of kin details, lasting power of attorney, comprehensive history, falls, mobility, mental state, ADLs, continence, medication review, examination. Again, all those parameters are captured, frailty score, relevant investigations, and then in the crisis care planning, let's put the respect form, dates, who was with me, and things. So then you might need few minutes to spend on editing this when you pull it through the communication letter on system one, and this would hopefully save you time to do these assessments. Thank you for watching.